Hey everyone, I'm Chris Wooke.
And I'm William Goff.
And we're 8th semester students at the University of Bridgeport School of Chiropractic. The topic of our video today, we're going to be giving exercises, prescription ideas for patients with low back pain. So sometimes you either have to increase mobility or stability, or sometimes both. So first, I'm going to start off giving a couple exercises I find useful for patients to increase mobility and flexibility. So the first one we're going to be doing knee to chest stretches. So Rusty's going to be my patient. He's going to lay on his back.
William.
Patients can do this on the couch or on the bed, wherever they're comfortable, especially for the older population. To start off, very low progression, keep one leg straight, and you're going to take the affected side up and grab it with your hands. Use a towel or belt for leverage, or grab behind the knee if it's a lot more comfortable. You should get a moderate comfortable stretch, flattening the low back a little bit. 20 to 30 second hold, and then you're going to do both sides a couple times each side throughout the day. If you want to further progress it, get more of a stretch, what you can do is take both knees, bring both of them to your chest. Same thing, grabbing them, lifting up the pelvis a little bit, and getting a nice little flat back, stretching out the posterior components of the lumbar spine. If you want to get further progression, get a better stretch, you patients can go face up onto your hands and knees. They can widen their stance on their knees, and then they can take their hips, rock back, arms forward, getting a nice light stretch on that lumbar spine. To widen the stance a little bit further and to rock back further makes it a lot more of a stretch. And then if you want to get a further stretch on one side, take one arm, cross it over, gets a lot more on the posterior components where the lats are. Same thing with the holding, 20-30 seconds each side, and should be comfortable, moderate stretch. So those are my flexibility, mobility exercises.
And I'm going to do some strengthening exercises for the low back as well. And now Chris will be my patient. All right, so first he's going to lay down on his back. And the first thing I'm going to do is just a very simple pelvic tilt. And this is to kind of strengthen the core muscles, like your deep abdominals and the muscles surrounding your spine. So what we do, I want you to put your hand kind of in the small of your back. And I want you to tilt your hip bone kind of down and around. And what you do for this is strengthen or tighten the abdominal muscles, and this will pull it down to the ground. And you want to feel the low back on the ground with your hand. Once you know you're doing that, you can remove your hand. And one of the big keys here is not to be pressing down with your feet. You really want your abdominal muscles to be pulling the pelvis down. Another thing you can do from here is to go directly up into what's called a bridge. And you stabilize your feet under you and just kind of lift your hips off the ground and squeezing your glutes. Some people don't think of the glutes as strengthening the low back, but they do connect and they help stabilize that entire area. And a progression for this, you can come back down. If you want to do something a little more intense, you could do a medicine ball or an exercise ball under the feet. We don't have one in the room. So basically your feet would be like this, and then you would try to do the bridge this way. And that will also increase the intensity, and that should help stabilize the low back. Chris, come on up. And I believe that is all we have for you today. Thank you, and have a good day.